Hello and welcome to India Top Doctor. Today we will talk about ENT, and for that we would like to invite Dr. Vijay Vitore. He is consultant ENT surgeon in GG Hospital, Aurangabad. He has been practicing since 22 years. He has an expertise in functional endoscopic sinus surgery, head and neck cancer surgery, microscopic ear surgery with special focus on nasal allergy, thyroid disorders, vertigo, and phonosurgery. So what are we waiting for? Let's welcome him. So welcome to India Top Doctor, sir.
Yes.
As you know, today we'll be talking about ENT. So can you tell our audience what are some of the common ENT problems?
Now, India is a developing country. In developing countries, there are a lot of ENT problems as compared to the developed countries or the European countries as such. Two things are very common. One is deaf mutism, which is found in the children who are newly born, due to certain viral infections. And second one is senile deafness. That is the deafness part which we see in the old age people. As the age goes on increasing, we come across a lot of patients, those who are unable to hear or they are hard of hearing. So these are two major problems which are coming down. Apart from that, in young children, tonsillitis is one important cause for infections in children, especially below 12 years of age. And in adults, allergic rhinitis is one of the cause. For a lot of people, they are having running nose, as you might have seen in a lot of places that they tend to sneeze out, or they are in some allergic conditions like AC or cooler, or whenever there is lot of what we can get a polluted area is there. At that time also you will see that there are allergic conditions prevailing in individuals. So they have a lot of allergy problem which can be countered by proper treatment. Thirdly, there is in young children, especially after the infancy. So you have some diseases which are related to ear. So you have discharging ear. So that is acute suppurative otitis media and chronic suppurative otitis media, where we find a lot of patients that they complain. You might have seen that there are small children who come with earache, swelling in the ear. Now, the fifth one is the most commonest which we find in India now, especially in the Asian countries like India, Pakistan, Nepal, Bangladesh, Bhutan, Sri Lanka. That is diseases related to your oral cavity, especially those who are gutka chewers, tobacco chewers, betel nut eaters. So these have lot of, and suddenly in last 20 years, what our experience shows, there is tremendous rise in oncology cases like cancer cases of the oral cavity. So these are the very, very common things which we come around in practice. What our observation says like.
All right, sir. So you gave really a deep insight of what are all the problems which requires the attention of ENT. Can you tell us more about the importance of ENT?
Yes. Now, previously, what used to happen 50 years before, ENT was not a branch. Ear, nose, throat was not a branch. It was a part of surgery branch, surgical branch, part of surgery department. Before 40 years or so, it has been changed into a branch of ENT. Now, there were no recent developments in ENT until we can say 25 years. Way back 25 years, then started a lot of things coming up. Now it is basically a procedure of orifices, means nose, ear, throat, sinuses, then respiratory tract, larynx, voice box. So now a lot of things have been developed since last 25 years, especially lasers, then endoscopes, endoscopic surgeries, microscopes, microscopic ear surgeries, head and neck cancer surgeries. Then apart from that, lot of new development has been accomplished in the treatment of allergies. So a lot of treatments relating to allergic like antihistaminics and other drugs especially immunomodulators and all that have come up, and new diagnostic procedures as well as therapeutic procedures have come in, especially endoscopes. Now, suppose we can take an example of change in voice. So previously we used to see it with a small mirror. It is called as indirect laryngoscopy mirror. But now everywhere endoscopes are available. So that is for the benefit of the doctor as well as the patient, that first instance we can come to a diagnosis that he is having laryngitis, or due to sorry due to common cold he is having a change in voice or hoarseness. So these type of patients we come across quite regularly. So investigative procedures and therapeutic procedures have come in hand with the ENT branch, and this ENT branch has flourished like anything. I would be very happy and thoughtful to say that ENT is one of the branch which is most demanded in US. Why? Because they are having very less ENT surgeons. Even in India, if you take out a list of the IMA practitioners, Indian Medical Academy practitioners of ENT, so there are very less. Like say in Mumbai, there might be around 150. Aurangabad, not more than 60 ENT specialists. So that is quite less to cater with to the people of around 30 lakhs or so. Okay, like my city over here. But overall, it is a branch to reckon with. It is a branch where right from the infant, one day baby, to the old age man of 75 years, everyone needs treatment from ENT at some point of time in his life. So it's an important branch, what I feel, and it is a good branch to take over for the new doctors who might be seeing this interview. I would say that for your post-graduation, opt for an ENT branch.
Absolutely, well said, sir. So we got to know about the importance of ENT. Can you tell us some of the important points to remember while dealing with the ENT problems?
Now, one thing is this: the patient cannot feign or fake things in front of an ENT doctor. If suppose a patient says that nothing has happened to my ear, just looking into the ear, we can say he has been either traumatized by a hit, or there has been some road traffic accident, or there has been some either thing, or there might be some infection. So most of the people, they try to feign things or fake things. So that should not be done. Second thing is that patient, when they comes up, the first and important way of coming to a doctor is you should come at the earliest point of time. The more early you come, the right diagnosis will come in place, the right modality of treatment will be coming there, and the post-disease complications would be avoided. So these are the things which we should keep in mind. Apart from that, especially in cases of oncology, cancer cases, whenever there are cancer cases, you can say that they should come at the very earliest, because slightest of ulcer or slightest of node, say a simple lymph node in the neck, it could be one of the striking feature for upcoming disease of cancer or oncology. So before coming, you should be very well, you should know what his problem is. Now suppose someone is asking that there is a earache, but the problem lies in your throat. So he should be very much careful about asking the doctor that I am having a throat pain also. Some patients, they don't do that. So that's why a lot of diseases are missed out. Because if he doesn't say that there is throat pain, I won't be seeing the throat that much, what we can say, seriously. But the thing is this, it is a composite department. Every part is involved. Like if the patient is having headache, so right from sinusitis to earache to ASM, CSM, or any tumor, or say simple procedures like simple diseases like polyps, they can also cause headache. So there are a lot of things to be seen before once a patient drops into your clinic or in your hospital. Okay.
Right, sir. So these, I'm sure it helped a lot for our audience. So can you go us through a little bit of the procedure when we deal with ENT problems?
Yeah. I will start from the basic one, not from the very ultra higher ones. Okay. Sure. The basic ones, first procedure any ENT surgeon would like to do or he likes to learn or what we can practice is tonsillectomy. Tonsil. Lot of young individuals might have seen. Previously, tonsillectomy was quite common. Every other child I used to undergo tonsillectomy, because what my personal experience shows, nowadays tonsillectomy has been reduced to quite a smaller number, because there are good group of medicines have been coming up, good what we can say, early diagnosis, and good number of doctors are treating the patients very well at the early stage. That's why chronic tonsillitis has become quite less. But still there are patients which come across with tonsillitis and they undergo tonsillectomy. One procedure is that. Second procedure is typical DNS, that is deviated nasal septum, where you have to correct the nasal septum so as to what we can say, that avoid to provide proper air entry for the individual. Okay. Third one is functional endoscopic sinus surgery, where you look into the sinus and do a surgery where the removal of the polyps, removal of the disease is needed. Fourth one is ear surgery, which is very common. There are almost 8 to 10 procedures which are to be done in a year. Okay, starting from the repair of the tympanic membrane, that is Tympanoplasty. There are 5 types of Tympanoplasty. Apart from that, there is mastectomy. There are 3 types of mastectomy again. And lastly, one of the most important procedures in ear surgery is cochlear implant, where you have an external device implanted into the ear itself, middle ear, into the mastoid cavity in the bony part of the ear, where the individual is able to hear. This is very common in young children. And nowadays, the adults are also undergoing these cochlear implants. That is a very costly procedure. One procedure almost costs 6 to 7 lakhs rupees. Okay. So most of the patients, they undergo this type of surgery, especially in government schemes or funding by the non-governmental organizations or NGOs and all that. Fine. Other surgeries which come across are head and neck surgeries. Now, head and neck surgeries are typical surgeries where you find out some tumors, some swelling, especially in the sinuses. Apart from that, in the neck, first foremost surgery is thyroid. Especially in females, it is very common complaint of thyroiditis. Okay, one is due to hormonal changes, and second is due to any other disease which could give rise to thyroiditis or any other swelling in the neck. So neck surgeries are very common, and to be precise and to be shortlist, the microlaryngeal surgeries, the surgeries which are to be done because for the vocal cords, that is restoration of the voice, or there is might be some oncology or cancer case of the larynx, you can correct that, you can remove it, or you can make surgeries which will able to enhance the voice of the patient. Right?
All right, sir. So you have had a long years of experience in this field. So I would like to ask you, as an ENT doctor, what kind of challenges do you face on a daily basis?
Now, first thing is convincing the patient is a very hard part, because most of the patients nowadays, it has become like that. Doctors have come under Consumer Protection Act. So most of the patients, they think that we are doing it for some other sake, some material gain or some monetary gain. It's not like that. Okay. So convincing the patient for a certain procedure is a big part. Secondly, the advice which we see a lot of individuals, they have a habit of putting a key or a matchstick in their ear always. Or we always tell the patients to don't eat gutka and this betel nuts and tobacco. Okay, but still they do that. So awareness is very less amongst the individuals, especially in India. Rest of the world, awareness is quite good in European countries. But in Asian countries, the awareness is very less. But still, I'm really happy for the individuals and the patients that most of the people, they are now coming up with complaints, and they are in connect with their doctors, respective doctors, as to what could be the ailment with them of ENT. And above all, the main challenge is to operate. Now, here, there are some technical difficulties when operating. Suppose I am operating an ear. So the disease is in the middle ear, but certain important structures are there. So to save that structure, they, at sometimes, not always, at sometimes there could be some residual disease also. So that is one of the things. But in the introduction equipments, this part is also taken care of. Then sometimes some post-operative complications occur, like bleedings. There could be post-operative bleeding after the surgery. Then sometimes the patient might be what we can in a debilitated stage, old age patient or immunocompromised patient or a weak patient, what we can say in a layman language. So at that time, we face a little bit of difficulty. Otherwise, it is a very clear-cut, fair practice branch.
All right, sir. So as you talked about the lack of awareness among people, so my last question from you would be, do you have any message for our audience?
3 messages. One message is, whenever you are having a sort of common cold or any other ailment, don't take it lightly. So to your local doctor, your general practitioner, any doctor. Because if it is a viral rhinitis or viral cold, common cold, we don't need to take any medicine. But we should know that it could, after 3 days, it could enter into a superadded infection or bacterial infection. So take care. 3 important senses are with the ENT branch. One is smell. Second one is hearing. Third one is speech, that is voice, and articulation of speech again with the tongue and oral cavity. So this is the half branch which is associated with that. So 3.5 branches are associated, major senses, what we can say. So whenever the patient thinks that there is some problem in this, so he should connect with the doctor. Apart from this, there are small children who get more affected by this inspection salt, or say while playing someone gets hit, while playing someone falls on the nose, has a deviated nasal septum, there could be injury to the nose, nasal bleeding. And lastly, the cosmetic procedure. Now coming to this cosmetic procedure, I forgot to tell that about that one of the major surgeries. Rhinoplasty is one of the procedures which we do. Nowadays ENT surgeons are doing a lot. Previously, a lot of plastic surgeons used to do that. But now the ENT people have taken it as their own domain. Okay. So rhinoplasty means giving the shape of the nose. Like you have seen the plastic surgery or nose plastic surgery of Shilpa Shetty, then lot of heroines and the heroes. This is for example. But apart from that, also in routine practice, you come across lot of individuals, those who have a crooked nose, or they think that they are having some problem with their nose. That's why they are not successful. So such patients, they do often come in the OPD. But if there is really a definitive correction surgery we could do for him or her, it is well and good. Otherwise, rhinoplasty is one of the procedures we can do it. And lastly is, take care of all your senses, especially hearing, speech, voice, your smell, everything is involved. Now you are in this COVID era, you might have heard the patients were saying they are unable to smell. So there was infection in COVID that the olfactory nerves were involved, where the olfaction comes in. Olfaction means smelling. The power of smelling is called as olfaction. So after that, they restored it after some period of time. But you should take care of all these things and avoid all the vices like betel nuts, gutka, cigarette smoking. Take care of your life. Life is very precious.
Absolutely well said, sir. Thank you so much for being here with us today.